Today we have Community First Health Plans, and I have Victoria and Brennan with us. Hello, Victoria and Brennan.
Hi,
Hi there.
We are so happy to have y'all join us and talk a little bit about Community First Health Plans and all the great work y'all do in the community. So let's just get started. Tell me a little bit about Community First and the work that y'all do and how y'all got here.
Definitely. So Community First Health Plans was actually established in 1995 by University Health with the goal of really beginning to provide healthcare coverage to Bexar County and the surrounding 7 counties. So we actually have a service area of Atascosa County, Bandera County, Bexar County, Comal County, Guadalupe County, Kendall County, Medina County, and Wilson County. So it's not just San Antonio that we service, it's also those surrounding counties. And our goal as the only locally owned health plan, nonprofit health plan here in San Antonio, is to really help all of our citizens and residents here to live a healthier lifestyle and make sure that they have access to the health insurance that they need.
Wow, that's a lot. I thought I knew about y'all, but y'all serve 7 counties, you said?
Yes, so 7 counties, and then including Bexar makes it 8.
Okay, so the surrounding area.
Yeah.
Well, I know South and Central Texas, of course, we have some health issues in our communities, right? And so it's good that y'all offer that beyond just Bexar County. And so tell me a little bit about your programs and services. Like, what do y'all do on a day-to-day basis?
Sure, we have many different plans, and it's growing all the time. We offer Medicaid and CHIP, Star Medicaid, CHIP. We have a Medicare Advantage plan that was added in 2020, and that is growing a lot. And we also have an HIE plan on the healthcare marketplace.
Okay, so you're gonna have to break it down for me a little bit more because
Sure.
I am oblivious. I'm oblivious. So you provide healthcare opportunities, and if I want to have a healthcare plan, like, I guess break it down a little bit more for me because
Sure.
I know nothing about health insurance and health
Right.
plans.
So if you want to, there's many different avenues. Medicaid and CHIP are through the state, and so that's something you would apply. You would head to yourtexasbenefits.com. And we're just one of the options that you can pick. We're one of 4 options available here in Bexar County. And as Victoria said, we're the only locally owned and only nonprofit option. And so if you're approved with Medicaid or CHIP with the state, we're just one of the ones that you can pick. And then also we have our Medicare Advantage Alamo plan that was added, and that is through Medicare.gov. And it is a Part C plan. So if you have Part A and B, you can add on Part C at no charge, and we just allow expanded coverage, more, just more benefits for you for your Medicare plan. And then we also have, yes, as I said, a marketplace plan, HIE. You can go to healthcare.gov, and we're also just one of the ones on there, along with all the other ones that are listed in the marketplace.
And just to add to that really quick, Medicare open enrollment is coming up this fall. Keep an eye out on our social media, on our websites, as well as all the government websites. So if you're interested in Medicare, which usually you have to be 65 and older to apply, but there are some other ways to apply and get accepted. So you can just keep an eye out for that. It's coming up quick.
Yeah, that's what I was going to ask. So there's Medicare and Medicaid. And so Medicare is for seniors for the most part. And then Medicaid is for lower socioeconomics?
Yes. And that's all income based. And that is when you apply, they assess your income level, and either Medicaid or CHIP, whatever you're placed with, it is all income based.
Okay. And what's CHIP?
Children's health insurance plan, and that is it still provides some partial coverage for those who may not qualify for Medicaid, but it just some expanded coverage for more people.
Okay. And then you have your marketplace, HIE, is that what you said?
Yes. The health insurance exchange. And as I said, that's at marketplace.gov, and that anyone can go look. And that one is for at charge, and it was just one of the ones that you can sign up for. That is online, yeah.
And then, so I know there's like, I guess health insurance, and there's like eye, and there's dental, and so like, do y'all cover all of that? Is there just health? Like, what types of insurances am I able to get through the marketplace?
It is just health insurance. Yes, we don't cover dental, so it is just pure, just health insurance.
Okay. And then there's a network of physicians in the region that I'm able to access?
That's correct, yes.
Okay. Yeah, I didn't have health insurance. Well, I had health insurance in college, right? So when you go to college, you can use your university's plan or whatever. But I really didn't use it that much. And then so when I graduated, probably from like at least 2014 to 2019, I didn't have health insurance at all. And then I got an internship in Canada. And so in order to go through this work transfer program, you had to have insurance to get into Canada. I was like, okay, I guess I'll do it. So I went to, I guess, the marketplace that you're talking about, and I tried to find the cheapest one that I could. But overall, it's actually not that cheap. I'm paying like, of course, prices have gone up, but I think I'm paying like 100 or so for my insurance monthly, and then I'm paying 50 a month for my dental, right? So about 150 a month. And I didn't use it at all. And when I went into Canada, they didn't even check for it. Like I was like, why did I even get this? But that was 2019, 2020, 2021. So 3 years, close to like, I don't know, $2,000. But I finally did need to go and use my dental. But when I got there, I found out it's not even dental insurance, it's a dental discount plan.
Oh no.
But you don't know, you don't know till you know. So these are all things I think as young adults that as you get older and you have to utilize these services, it's important to have that education about it.
Yes, that happens. That happens to a lot of young mothers. So, you may just have graduated high school or college, and you're in the same situation. So many people find themselves in that situation. What is insurance? How does it work? And let's say you're pregnant now and now you have a baby. Well, now you need health insurance. So you can maybe get by when you're young and not need it. I had my health insurance through my parents for the longest time and I never used it. But now you have a baby coming, and so you have to go to your doctor's visits. You need all that help. And so we really try to break it down and provide flyers, pamphlets, informational sessions, as much as we can to help you understand what is health insurance, what do you get with it, what are the benefits, so that way you can make the best decision possible for you and your soon-to-be child or whatever situation you might find yourself in.
Yes, education is key, education and access. So tell me a little bit, let's switch gears a little bit. Gardopia, y'all are supporting Gardopia. We set up a food pantry. We're doing farmers markets. Tell us a little bit about the food pantry program and other things like Gardopia that align with your mission.
Definitely. So our partnership with you has really been super in alignment with what our goals are. So I know Gardopia's mission, when I first talked to you, I want to say it's over a year ago now, I think, you were telling us about your mission and how it really is more than just gardening. It really is more than just having a garden that's open to the community. It's about empowering and educating our community on what it is to live a healthy lifestyle. And so that's really in alignment with us and our program, because it is more than just having health insurance. It's also about living a healthy lifestyle, understanding what that means. So not only you, but maybe your senior mother or your baby can also live healthy lifestyles and fully understand what it means to be healthy. And as you've mentioned before, San Antonio and especially the surrounding counties, we do have high rates of unhealthy things like obesity, diabetes, the list goes on, cardiovascular disease. And so with you all, educating about healthier meals, plant-based diets, and how important that is, and us also expanding on that, I really think that we have the perfect partnership. And so for those of you that don't know, Stephen and Gardopia are our second food pantry location. And I believe it was in July or August of 2021 that we had that installation. And so our food pantry programs are really something that everybody in the community can get involved in. So whether you're a host organization like Gardopia Gardens that allows us to place these food pantries on their premises, or you're a volunteer who goes out of your way or just on your drive home stops and fills it up with diapers, food, first aid kits. Or if you're in need of the items, you can come and take. Or the fourth way that you can become involved is just to be an advocate. Spread the word, tell people about it. Even if you can't deliver food or you don't need to take food, just spreading the word and making the community aware of all these food pantries that we have available now is extremely important. And we've seen so much use and so much growth out of these food pantries. I believe the Gardopia pantry is at over 1,000 door opens. We have a door counter that counts. And so it's pretty amazing how many people are utilizing these food pantries and how much we're helping the community together.
Yeah, no, when y'all brought the food pantry concept to us, it was perfectly situated for us to enter into that arena because Gardopia is open on Saturday mornings. People can come and volunteer, harvest produce, and then throughout the week, we're in and out. And anytime we are at Gardopia and the gates are open, people are walking in. So you can see that there's a need there, but not everybody's just going to go harvest some kale, right, and walk down the street with it. And so having non-perishable items, toiletries that are available, grab and go, very visible, on a very high commercial corridor, is definitely helping address the problem, right? And so how many are y'all at currently? I know y'all had a goal of 20.
Yes, we are at 15 currently. We have another installation this Friday and another installation next Tuesday. We have actually partnered with Harlandale ISD, which is, I'm sure you know where Harlandale is in that location. So we have partnered with them to place another 15 pantries or 14 pantries, excuse me, at their schools. And then we've also had a lot of interest from that. And so we are on track to have 50 pantries in San Antonio and the surrounding counties by the end of the year, this year.
Y'all more than doubled the goal. That's awesome.
Yes.
Yeah, I am familiar with Harlandale on the south side. And so, when we look at these maps and we see where the health inequities exist, that is one of those pockets that is underserved in multiple ways. I'm looking at y'all's website, I'm looking at your philanthropic efforts. So education, food insecurity and disaster relief, health and wellness, diversity and inclusiveness. Those are great things to support. And again, sometimes people think, oh, it's an insurance company, all they're doing is selling insurance, but clearly y'all are doing more than that.
Right. Yes. No, since we are a nonprofit, all of the dollars that, we receive get funneled right back into the community and helping us serve the community the best way we can. And so we really are what our name is. We really do put our community first. And while, yes, we are providing a health plan, we know how important it is to, like I said prior, to make sure that all of our community members understand how to live a healthier lifestyle and spread that with their family members, cousins, extended family, because that's how we become a healthier community overall.
Yeah, I know that there's this big debate about universal healthcare, right? And so everybody needs healthcare. And I know that the Affordable Healthcare Act, sort of helped with that. And hopefully we can continue moving in that direction. I do want to really quickly just highlight some of the health disparities that we're experiencing here in San Antonio. So I was mentioning to you a little earlier, there's the Bexar County Health Collaborative, and they come out with a report every few years. So the last report was in 2019, and this data is from 2011 through 2017. But you can see that if we just look at this map right here, life expectancy and our health outcomes. So this is the life expectancy at birth years, by census tract from 2015 to 2017. And we have, I'm going to go down a little bit. There we go. From 69 all the way up to 88. And it's just like a checkerboard, right? Like there's just so much differences from one zip code to the other. So, for your clientele and your clients, what do you see? What do you hear from them in regards to their community and how health is being impacted?
Definitely. So our outreach team can speak to this. Definitely. They go to, Brendan, how many events in the past month? 25?
Something like 25, almost 30.
Correct. So they go to 20 to 30 events every month around San Antonio. And we do specifically target these areas where education is not as prevalent. They don't fully have the resources that they need to fully understand and feel empowered to make these decisions about, like you mentioned, health insurance at a young age. Nobody really talks about it. You just kind of get thrown into it. One day you need dental insurance and then you find out how it all works. And so our goal as a health plan is to really target each individual person and really help educate them and empower them. And so we do that with our outreach team going to 20 to 30 events a month, which is insane. We do that through social media. We do that through brochures. We do that through flyers. And then we also do that, through our food pantries. Even though there's not somebody standing there educating, you can't fully learn and understand if you haven't had a meal this morning. So food as one of the social determinants of health is really important. And so I think that's why our food pantries are not only doing so well, but are really making a big impact. I'm not sure if I covered it all, Brennan.
Yeah, no, the number one thing I hear speaking to people out at events is, I don't have insurance. I don't think I will qualify. Really, they don't know how to even try. And so, we have our guides that we try to give out, and we try to, yes, empower people and make sure they understand, they're informed of that they can apply. They should at least, give it a shot, see if they can qualify, and yeah, get some health coverage, and really try to take preventative health measures to, yes, increase all of these life expectancy, just make our whole community a healthier place.
Wow, 20 to 30 events a month. That's like almost every day.
It's tough. Very busy. There's a team of 6 of us, so we're not all, not all me, but it is very busy. We're all out there, pretty much 3 or 4 times a week.
Amazing. I know that the outreach is critical to spreading the word, right? Of course, there's social media and there's TV and there's all these things, but word of mouth and person to person is sometimes the best way. And Victoria, you hit on the social determinants of health. There are a few things that affect that: policy making, social factors, health, services, individual behavior, biology, and genetics. So if we go down to health services, lack of availability, high cost, lack of insurance coverage, limited language access. So these barriers to accessing health services lead to unmet health needs, delays in receiving appropriate care, inability to get preventative services, hospitalizations that could be prevented. And so that's what we really try to push is prevention. You get down to individual behavior. So diet, physical activity, of course, alcohol, cigarette, and other drug use, hand washing. Who would have thought?
We've learned that a lot over the past couple of years.
Yes. And so, if people are more interested in learning, this is healthypeople.gov. There's also the CDC. And one thing I just wanted to bring up is heart disease is the leading cause of death in the United States, right? And so the term heart disease refers to several types of heart conditions. If we go a little deeper in learning about heart disease, the different types of symptoms, risk factors. So diabetes, overweight and obesity, unhealthy diet, physical activity, excessive alcohol use. 4 out of 5 of those right there, but all of these are, what are slightly preventable unless you have a genetic or biological disorder. So, gardening and getting outside, eating healthy, having access to these things, can really decrease the leading factor of death in the United States. So tell us, how can people get involved with Community First? Are there any upcoming events that y'all have? Website, social media? Just how can people connect in?
Yeah. So, number one, for me always is the food pantries. Like I mentioned before, there's 4 ways to be involved. Anybody can get involved, whether you're hosting like you are, or delivering donations on your way home from work or on your way to work. They're open, majority of them are open 24/7. So even if you work an overnight shift, I know we have so many medical professionals and other professionals that work overnight. These food pantries are accessible 24 hours a day, 7 days a week. Or if you're utilizing the pantries or just being an advocate. So that's the first and easiest way, in my opinion, to get involved with Community First. Second, social media. We are active on all of our social media accounts. Facebook is my personal favorite, but we also have Instagram and Twitter. And so you can find us on social media. You can find us on TV or here on this podcast. And then you can also find us at events. And I'll let Brennan talk a little bit more about the events that we're at.
Sure. We are at, pretty much any resource fair, any health fair in town that you can find. I'm going to one later today at Poe Middle School. And we have a couple this weekend. I know CPS Energy is doing some community fairs that will be at a couple of those over the next couple of weeks. And, we're out there, like I said, just educating people. If anyone has any questions, we have our guides that are really helpful for people to understand what they need to do to receive coverage and then what we can offer them. And, we also have goodies, giveaways if y'all, interested in that. We all have little things. We try to keep it health related stuff that, can help you out. It's not just toys or knickknacks. It's things that will, either educate or empower people to be more healthy. And so we're always looking for more events all the time. That is, our number one. We just want to be out as much as possible. And as I said, we are really busy now. Everything's was kind of backlogged from COVID. A lot of things have been canceled over the past few years, and now all of them are happening again. All the makeups from 2020 and 2021 are all happening now, and we just want to be out there as much as we can. So if anyone is having an event out there, feel free to shoot us an email and or just let us know. Come out to see us, and we would love to be there.
And lastly, we have our garden event.
Yes.
We have one Saturday, May 21st, and then coming up in June for Juneteenth, I believe it's June 18th that we're going to celebrate. So you can find us there as well. And then you can get 2 birds in 1 stone. You can talk to Stephen and you can talk to us.
Heck yeah, I'm super excited. It's hard to believe that it's already May 21st coming in the next few days. But as you said, we also have one in June for anybody who's hearing this podcast a little bit later, and I'm sure in the future. I want to show y'all's website real quick as well. So y'all have this campaign right now, Proud to be Local. I've been seeing this in my social media feeds quite a bit. And then you were saying the food pantries. So I just want so people can see sort of where those are. 24/7 access, like you said, freestanding, weatherproof. For me, they were very well engineered. No cost registration, and you got this little map right here. So if people are interested, I think I see Gardopia's right there.
Yes.
All right. Nice. So you can always find the pantries that way. And if anybody's listening and you're in San Antonio, please do support these food pantries because as soon as they get filled, they get emptied like almost immediately that same night. I can't tell you how many times I've put food in there and then somebody just walks up, takes it, walks up, takes it, walks up, take it the next morning, empty. So it's a continual thing that I know it's not just Gardopia. I'm sure all of these locations can also use that support. And then like you said, y'all have y'all's news and events. I saw y'all have some kids Zumba coming up. Looks like today. It's fun, and we're gonna have Zumba at Gardopia. Is this online? Yep, it's online. Okay,
yes.
Awesome. And I guess they can just contact you, right? If they have any questions, would they contact the corporate or community office? Either one.
Either one, or just so I can say it here on this podcast, you can email info, info @cfhp.com. And we see those emails and we can direct you to whoever you need to be directed to for whatever question you have. But yeah, we're super excited about the pantries. So like Stephen said, please help, please donate. You can adopt a pantry and commit yourself to donating once a week, once a month. Anything helps.
And tentatively next month, this is our Avenida Guadalupe community office. We are have been closed due to COVID, but we are tentatively going to be reopening next month. So this is our outward facing office at 1410 Guadalupe Street. And if anyone wants to come in, you know, starting next month, we will be there and in person to assist you with anything you need.
Perfect, perfect. Well, again, thank you all for all the work that you do in the community for keeping people healthy and connecting them to healthcare, because we know those services are critical to our quality of life as humans, right? Whether you're young or old, it's always needed. So hopefully we will see y'all in the future. Thank you for our listeners for growing our future podcast, and stay tuned for our next episode. Adios. All right, let me stop recording.